Okay, are we ready to start?
We are ready.
Okay. Welcome to the second session in our three-part series on the intersections of COVID-19, health disparities, racism, and social work practice in the current moment. My name is Rachel Voth-Strog, and I am one of the facilitators of today's panel, which will share insights and experiences of social workers who are currently practicing in settings across North Texas. The first panel in our series featured UTA School of Social Work faculty members providing critical data and context to equip our social work community for action and advocacy to combat the overlapping pandemics of COVID-19 and structural racism. If you did not get a chance to participate in that panel live, recordings can be found across UTA School of Social Work social media platforms. It highlighted that health, mental health, economic, and services access disparities are all fueled by racism, systems of oppression, and other social determinants of health. And that we have seen the consequences of white supremacy over generations, and specifically in the murders of Black men and women by the police. Now, COVID-19 has created major social disruption, exacerbating existing disparities, while also impacting how we implement social work services that are an incomplete part of responding to disparities and creating equity. Building on that foundation, we believe that it is critical to center the voices and experiences of social workers across specialties and fields of practice who are doing this work right now. Today, we will hear from 5 incredible social workers about how the coronavirus and social distancing has impacted their work with clients and systems, their hopes for the role of social work in addressing racism and creating health equity, and what self-care looks like in the current moment. Please also plan to join us next week for the final event in our series, an online community town hall focused on moving ahead together. Before we introduce our panelists, there are a few ground rules I'd like to cover. First, we are offering CEUs for attending today's event. Participants who want to earn CEUs must watch the Zoom presentation. If you're on Facebook, you can find the link in the comments section in order to receive credit. That's the way we can document your attendance during the presentation. While all attendees will be muted throughout the session, there will be an opportunity for the audience to ask questions of our panelists during the last 30 minutes of the session. Zoom attendees can enter their questions through the Q&A feature on the control bar at the bottom of their screen. You will also have the opportunity to see the questions submitted by other attendees. And if someone has the same or similar question, you can upvote that question to allow us to determine which questions are popular amongst the audience. Please keep in mind that the Q&A feature is separate from the comments section. So be sure to enter any questions for the panel in the Q&A section. For Facebook attendees, you can enter the questions in the comments section of the live video. We will monitor those and send them on to the panelists. We also have an opportunity to participate in co-creating a word cloud that will be shared as the panelists reflect on sustainable self-care. To participate, please go to www.menti.com and use the code 658051 to enter up to 3 words or phrases in response to the question, what does sustainable self-care look like for you right now? We will share the word cloud later in the presentation. You can find the details for how to participate in this activity in the comments section on Zoom and Facebook in a moment. I also want to acknowledge and normalize that for me, and I suspect for many of us in this moment, sometimes the answer to that question, what does sustainable self-care look like for you right now, is it doesn't. That's one reason we wanted to highlight the importance of self-care today. Sometimes when we are personally tapped out, hearing about what's working for others or what has worked for them in the past can give us new ideas and insights. We hope that this part of our conversation will do that for some of us today. We also want to encourage anyone who's struggling right now to reach out to the community resources that are available to help. And we've included phone numbers and chat lines with that information in the comment boxes and on Zoom and Facebook as well. Joining me in facilitating today's panel is Assistant Professor in Practice, Tracy Orwig. Tracy and I would also like to acknowledge the work of Assistant Professor in Practice, Marcela Neva, who was critical in the planning and development and orchestration of this event, but who had a last-minute conflict and is unable to be with us live today. We also want to recognize the larger series planning team of UTA School of Social Work faculty and staff, and especially our fabulous communications team who is handling the logistics. Now I'm thrilled to introduce today's panelists. Criselda Inahosa is a native of the Rio Grande Valley. She relocated to North Texas in 2004 to attend the University of North Texas and received her bachelor's degree in social work in 2008. She went on to work for AIDS Outreach Center, a nonprofit agency servicing patients affected by HIV and AIDS in North Texas. She also has worked for Cancer Care Services, another nonprofit serving Tarrant, Parker, and Hood County patients and families affected by a cancer diagnosis. After 7 years of employment with Cancer Care Services, she left to pursue her master's in social work from TCU. Criselda is now an inpatient case manager at JPS Health Network. She joins us from the COVID floor today and has been serving their vulnerable population for almost 2 years. Her areas of interest are social determinants of health and healthcare disparities affecting residents of Tarrant County. Adrian Johnson is an alumna of the UTA School of Social Work and a licensed master social worker. Adrian has a bachelor's degree from the University of North Texas in Human Development and Family Studies and has spent time working in child welfare as an intern at the Children's Advocacy Center of Collin County and as a CPS investigator in Dallas County. Adrian has experience working in mental health with those experiencing eating disorders and is currently employed at Children's Medical Center as a clinical social worker working in the intensive care unit and general pediatric service lines. Carmen Charles is a graduate of Southern University and A&M College, where she received a Bachelor's of Science degree in microbiology. She is also a graduate of the University of Texas at Arlington with a Master of Science in Social Work degree and is an LMSW here in Texas. She has been working in various aspects of social services for nearly 15 years and has been working for Safe Haven of Tarrant County for 5 years. She initially started working with Safe Haven in the Safe Living Housing Department and currently serves as the Program Director for Crisis and Outreach Services, overseeing non-residential crisis services, as well as the Tarrant County Domestic Violence High Risk Team. Michelle Young is a licensed master social worker, an advanced and internationally certified prevention specialist, and a certified tobacco trained specialist. She currently works across Dallas County, serving as the Youth Prevention Program Coordinator at the University of Texas at Arlington's Center for Addiction and Recovery Studies. She is also an adjunct professor with the university. And finally, Dr. Donetta Smith has over 15 years of experience in the field of social work, primarily working in the community across the Dallas-Fort Worth Metroplex. She has worked on programs to assist low-income and impoverished families, such as free income tax assistance, financial assistance for Hurricane Katrina and Rita victims, as well as researching and analyzing policies that affect families across the state of Texas. In 2013, she began the Strong Families Coalition of Greater Tarrant County to provide collaboration amongst organizations that assist vulnerable families. Currently, Dr. Smith is the Assistant Dean of Field Education at the School of Social Work, where her department is responsible for overseeing more than 800 students in field placements across the state of Texas and beyond. Dr. Smith has 2 busy children, Grace, who will be 3 this month, and DJ, who's 10. I'd now like to introduce Assistant Professor in Practice, Tracy Orwig, to facilitate today's panel.
Thank you, Rachel. And thank you to all so much for joining us today to share your experiences and insights. I know I and all of our attendees are so honored that you have taken the time to join us. We are excited to learn from you today. To give an overview of how this will work, I will pose a question and each panelist will have a chance to respond before we move to the next question. Questions from the audience will be included in the question and answer time at the end of the panel. So we will start with Chris first. The first question is, how has COVID-19 impacted how you work and the way you work with clients? And how has it impacted some of your most vulnerable clients?
What we've seen here at the hospital is that that there's multi-generational living situations. So if one person gets affected, you see multiple family members get affected. So, and then to protect the staff, both nurses, doctors, social workers, we're limiting the amount of times that we come into contact with these patients directly. So most of my work is being done by phone.
Thank you, Chris. Now we'll move to Adrian.
I work primarily in the pediatric intensive care unit, and my role consists of providing support to the patient and families that are admitted. And so that typically consists of that direct in-person emotional support, supportive counseling, conducting psychosocial assessments, and providing those necessary resources. COVID has impacted the model and the way in which we work with our families. And so a lot of that in-person care has transitioned to working by phone, kind of as Chris mentioned, to kind of preserve PPE and encourage social distancing. And so it's very hard when you're, building rapport by phone and you have a mask on and families have masks on to read those nonverbal cues and to build that rapport. And so that's been very difficult, but it's very essential in the work that we do to keep ourselves safe and keep our patient families safe and the patients as well, and kind of reducing that exposure risk. And so we have just been really trying to minimize interactions with patient families and doing more work by phone and encouraging staff to do that as well. I would say probably the main way that most of our patients have been impacted, and all patients, regardless of their diagnosis, is with the visitation restrictions that are in place. Working with patients that are under 18, infants, children's, they all have family. They have usually two parents or two caregivers, whether it's mom and dad, grandparents, extended family members. It's really hard to enforce that limit and only saying only one person can be here, especially in the ICU setting. And so that's been, I think, the hardest thing for a lot of our patient families that are coming in to deal with, because that's impacting everyone who is there at this time.
Thank you, Adrian. And now we'll move to Carmen.
So, of course, unfortunately, this pandemic has impacted our survivors greatly, and it has definitely been a challenge. The work that we do, and particularly as we work in the crisis and outreach department. So, we work out of our resource centers. We have a number of survivors that know that we're in the building. And so for them, it's easier to just walk in. And we have not been able to really service those clients in a way that we traditionally would. It has been more emergency services needs. So if somebody is having a true episode, they're needing to come in for an assessment for emergency shelter. We were able to do that up until last week, actually. And so because of the increase in numbers that, we're all seeing across the news right now, our CEO and our board of directors felt that it was best that we go strictly to remote services here for non-residential services. Of course, we have been throughout the entire pandemic providing services to our survivors remotely. And so for us, we've been able to maintain our crisis hotline, which is, the entry really into all of our services. And so we have been able to, of course, maintain that, but to actually complete intake assessments for the services that a client may need here within Safe Haven, it has been challenging to do by phone. We also have to understand that there are going to be survivors that currently, when the whole world is shut down, where can you go safely? And if you're trapped at home with an abusive partner, how can you call for help? How can you call to speak with an advocate about safety planning and your options when you have an abusive partner that's right there? So that has definitely impacted our survivors. in a way that, it's really scary. And so we, are doing our best to make sure that they know that we are still here and available when they have an opportunity.
Thank you, Carmen. And Michelle, we'd like to move to you next.
There we go. So it has definitely impacted our program in how we deliver services. We provide prevention education, which is primarily done direct practice face-to-face. So we work with both Dallas and Tarrant County, with schools, with the community partners that we partner with. And we generally go out to those locations and we meet with those students there. So with schools being shut down, that definitely had a huge impact on our availability and capability of delivering services. So we had to navigate and figure out how we could do things differently and still have an impact and still be a presence and still be of service and help. So we had to really just kind of navigate within a week's time, figure out how we can work virtually. So we worked pretty quickly on figuring out how we could still engage with our students, because once you lose that rapport with them, it's really hard to get them re-engaged with anything that you want to do. So still trying to reach out to them every single week and engage with them and just do check-ins. A lot of the population that we work with, social and emotional learning is a huge component of the school setting, and it's so significant to them. And being no longer in school, and sometimes school is a safe place for our students. Home is not that safe place for them, but school is, and no longer having that space in that place where you feel like you can open up and discuss your feelings and your thoughts and your emotions is a huge drawback. So we wanted to make sure that we still had a capability of interacting and engaging with them. So while we are still continuing to work to do that, it's still, there are a lot of barriers to being able to engage with youth. One of the biggest disparities is lack of technology or access to Wi-Fi, and not just being able to connect with us in that manner. So we are doing as much as we can to try to overcome those barriers and still be of service.
Thank you so much, Michelle. And now we'll move to Donetta.
Okay, well, being the assistant dean of field and in a pandemic is definitely interesting. Let's use that word. It has been very much a challenge, of course. We have summer is actually one of our larger semesters. And so this summer we have about, I think, 875 students in a field placement across the state. And what we found is, of course, a lot of the agencies that we normally send students to had to either close due to the pandemic, or they just did not have capacity right now to actually take students in just them trying to figure out and navigate how they're going to work their services during the pandemic. And so one of the things that we had to do was obviously get very creative because, of course, we still have students who want to graduate. And so we had roughly 150 students or so that we actually created an in-house program for. And those students are working on what's called the COVID support initiative. And what that initiative has done is we've created basically basic case management that we're providing with the interns to UTA students specifically right now. However, we will plan to expand that in the fall and offer it to the local ISDs as well as the community colleges, and just providing, again, basic services, referrals to resources that either are within the school or within the community, out in the community, as well as providing some coaching and mentoring. So interns assisting, students as they transition to online classes, assisting them with understanding and coping in what's going on right now and not feeling so isolated. We're also providing support groups for students in developing those. And then we are also providing virtual workshops where students can gain more information around different topics. So students who are parenting and how to deal with that and time management, things of that nature. And so that process has been a challenge even for this CAP focused person. Administratively, it has it's been a challenge. You know, there are so many moving pieces just in the field office in and of itself without a crisis, without a pandemic. And so when you add this on top of that, it has surely presented itself to be very challenging. Again, just like everyone else, we are working from home. And so, you know, building rapport with students, being able to reach out to students, ensuring that we're, you know, keeping that constant communication with those hundreds of students, as well as the agencies that are still taking students. It is challenging, but I think that, you know, in having such a great support system amongst the field office and even with our faculty have been absolutely amazing, as well as the Division of Student Success and the liaisons. That has really helped in order to ensure that these students are getting the best experience possible. So yes, it has been a challenge.
Thank you, Dawnetta. And it sounds like each of y'all adapted your services in order to meet your clients where they're at and figure out how to provide services to them and build that rapport and build those relationships. So that's amazing. We'll move to the second question now. We'll start with Chris. Can you share some of your successes in your personal practice or in your organizational response to COVID-19?
Well, let me tell you that you have to be very, very creative in coming up with discharge plans and resources that may not normally be available or that would be normally available that are no longer available. So I know in the field of social work, they stress those critical thinking skills. You definitely are honing those skills while developing discharge plans and how to safely discharge a patient, whether they live alone or with family. So again, things are very, very creative. I know that especially with those homeless patients, we had to get creative on where we would send them because the shelters, you have to remember, they have to social distance as well. So they adapted, and you have to also work very, very closely with your community resources as well to figure out how those things have adapted to serve that population or different populations. So, and then you always are stressing to work together as a team to the benefit of the patient. That is even more so critical now than it was before. So, because in the end, it's all about the patient and the patient safety. So.
Thank you, Chris. And Adrian.
I would say that our organization has done a great job as a whole conducting screenings daily of staff and patient families when entering the building. We get a sticker, we get a sign that says, or a sticker, that label that says that, you know, we've completed our screening today. And we have signage up throughout the hospital to remind people to social distance. And the organization has been pretty transparent. Weekly, we're having town halls with updates because everything is ever changing. There's always something new. We are wearing masks and eye protective wear, goggles with every patient that we're seeing, regardless of their diagnosis, just to continue to be safe and continuing to keep that distance between us and the patient families when we're working with them. And I would say my personal practice, I'm getting better with conducting phone assessments, and I typically will call my families and screen them and just kind of check in and just let them know I'm honoring social distancing, but want to check in on them. And if there's anything that I can provide for them and bring up to the room, I'm happy to do it, but just kind of will check in with them first before doing so. And that obviously will depend on the situation and their diagnosis, but that's typically what we've been kind of doing. And we have started social determinants of health screenings with some of our general pediatric patients that are usually not followed by a social worker long-term and a chronic service line. So they're kind of in and out. And so we've been kind of just checking in for any barriers to care that they might be having, such as financial, with so many people unemployed at this time. So checking for those financial barriers to receiving care, any transportation issues, and providing those necessary resources that families might need that are in and out. So we've been implementing that during this time. And that's been working very well too, just to kind of make sure that the patients and families that are needing assistance during this time are getting all the resources that they need.
Thank you, Adrian. And we'll move to Carmen.
So I have also been very pleased with how Safe Haven has been able to provide resources, for our survivors and, services for our survivors, with limited resources. Because in the beginning, we kind of were all in this like, okay, what do we do now? We've got to quickly come up with a plan to be able to execute service delivery. And just do it differently. And so, we've been able to, do our thing, just doing it in a different manner. But I think that it really goes to show you that, like Chris was mentioning, this is going to be the time where you really kind of have to think outside of the box, and using those critical thinking skills is essential right now. And so we've definitely had to do that. We, of course, we have 2 emergency shelters, and prior to this pandemic, right, we were full in both shelters. And so then as we are getting, court orders stating that, things are shutting down, we're having to reduce capacity in places, we're going to have to try to make sure that we're able to appropriately socially distance. What do you do with 2 shelters that are already full? And so we went to, it was really, we really could not basically admit anyone else into shelter until, we were kind of at a reduced capacity, so that everybody could appropriately social distance, which we actually got to pretty quickly. And then there was a time period when we were approving people for emergency shelter, and they were, unfortunately had to weigh their options. Is it safer for me to stay at home with an abusive partner, or to go into an emergency shelter with a pandemic going on and the uncertainty and unknown of this place that I've never been? And so, a number of our survivors chose to stay home because they know that situation. They know, their situation best. And so that was familiar for them. And then kind of as things started to open back up, we started to see that more of our survivors were not only calling for emergency shelter, being accepted into emergency shelter, but actually showing up to our pickup locations for that. So I've just been very proud of the way that we've responded to that. We have had staff on the front lines, nonstop this entire time in serving survivors. And again, we don't know, we do kind of a general screening when we are completing the shelter assessments, when people are calling for emergency shelter, we do those assessments, but it's self-report, right? So we don't necessarily know if what they're saying is accurate. I mean, these are survivors who are essentially trying to survive. So they're going to do what they need to do to access the resource that they need. And so, and even in that, we let them know, we're going to ask you a few questions. This in no way determines, whether or not you're going to be accepted or decline for emergency shelter, because at that point, you need it, we're approving you. But in the event that you actually did say, yes, I do have a fever, yes, I am experiencing these symptoms, we're still going to bring you into our emergency shelter. It's just figuring out how to be able to serve you as safely as possible and maintain the safety of the staff and other residents. So I've just been very proud of the work that we've done. And it looks like it's going to continue to be this way for a while. And so we're working on it, and we're learning and growing as we go.
Thank you. And that is a good point. We are learning and growing as we go. So we'll move to Michelle next. You're muted, Michelle.
Always. So we definitely had to become very tech savvy, really fast, and really quick. So as I mentioned, we do prevention education, and most of that is always done face-to-face direct practice work. So we had to figure out how to navigate that and still be of service to the community virtually. So we actually go out to schools, and because schools were shut down, we still needed to connect with our students. So we had to figure out how we could do that and still have a safe space for them to talk and discuss. I think someone mentioned earlier, it's really hard to have an open dialogue and conversation when the person that you're talking about might be in the same room as you. So we have to think about and navigate all of these different situations and figure out how could we still have these open conversations with them and make it a safe space for all involved, and be mindful of the environment that they're in. So that was definitely one of those things that we really had to navigate and practice in role play. We do a lot of role plays to kind of prepare us for actually the intervention with our students and how could we navigate this. And these are some things that we figure out how, oh man, we didn't even think about this, but now that we've role played it, this is something that might come up. How do we navigate that? How do we navigate around that? So we came up with safe words that students can use if they want to talk about something, but they're uncomfortable and there's someone in their space that they can't talk about that with. So we came up with things like that we can use. Activities. So we do a lot of interactive activities with students. And during the summer, especially, they usually go to camps, rec centers during the summer. And due to the pandemic, so many rec centers were closed. Some of them were still able to open, but so Dallas County has 45 rec centers and only 13 of those 45 were allowed to open. And so many of the students that we work with depend upon those rec centers for a safe place to be, but also for breakfast and lunch because they have meal programs there. So that's tons of people who are now faced with, how do I get food? How do I have some place for my kids to go during the daytime when I need to go to work? So there's so many disparities that happen on top of the pandemic that a lot of the population that we work with deal with. So we came up with something called positive alternatives. So we have little packets that we partner with. Right now we're partnering with our Arlington libraries, and we pass out activity packets during their drive-through meal line. We wear masks. We're going to make sure that, there's no contact. We're always social distancing and following CDC guidelines. But then we're also hosting some live virtual events to interact with the students while they do the activities so that we're still able to engage with them. We're still able to talk to them about social and emotional learning because sometimes I think we forget as adults that as we're going through this pandemic and all the anxiety and the stress that's happening, our kids are experiencing that too, right? So nobody's talking to the kids about, hey, how are you dealing with this? What's different for you? How are you processing all of these things that are happening? How your world is changing around you and you don't know what's coming up next. So taking that time to interact with our students and have those discussions with them is really important, and having them know that it's important for them to process those thoughts, those feelings, those ideas, and not keep those things bottled up too.
Thank you, Michelle. Now we'll move to Donetta.
Yes, so I think the greatest success for in my role has definitely been us creating the initiative in order to ensure that every single student had some place to intern during the summer. I also will say that just our students and their resilience. We still have students who are actually out in the community and they're still going to their placements. We have students who, many of them are doing virtual placements. And so they're doing telehealth and things like that. So just the resilience of our students and them continuing to charge forward. And then looking at, internally looking at our faculty and looking at those who have really stepped up to kind of come around the field office and just help us in any way possible to ensure, again, that those students are successful in their placements and that they have a placement, period. So I think looking career-wise for me, if you will, that's probably the greatest success. But personally, just my son being able to finish the 4th grade and move on, and being a single mom and figuring out homeschooling, daycare because of my 2-year-old and still field. Yes, we're still sane. So that is probably my greatest personal success in all of this, definitely.
Thank you. It is a balance and trying to figure it out. So we'll move to the 3rd question. We'll start with Chris. What else would you like to see social workers doing to create health equity and address racism in your context? You're muted, Chris.
A lot of our patients don't have insurance. So a lot of the times, what's great about working for a county hospital is that regardless of whether they have insurance or not, they're going to get care, which is one of the things that I really do appreciate, especially right now, because they don't need to be worried about whether or not they should or could come into the hospital for treatment in a situation like this. So that's one good thing. The other things, everybody gets the same access to care. So nobody gets any special or more special treatment than the other. So that's another great thing that I really, really appreciate. But what you do see a lot of is, again, people with lack of access to healthcare, and then they're afraid to come in because they don't have that access. So they'll go to the community clinics. Luckily, because the community clinics don't have the level of care that these patients need, they are directed to their local emergency room and saying, hey, you need to go, you need to get checked in. But what this pandemic has created is a fear of coming to the hospitals for other healthcare reasons because they're afraid of catching COVID. And that's one thing I would like to stress is, hey, just because there's a pandemic going on doesn't mean that your health care is any less important than those that are getting treated for COVID. And that was one thing that I took into consideration when taking on COVID patients, is that these patients are equally as scared as we are as the service providers, but they need the same level of care that we would give anybody else. So, but I would just like to, anybody that can see this, anybody watching, anybody that needs healthcare, seek it out. Don't be afraid, because the hospital itself will protect you. So.
Thank you, Chris. And we'll move to Adrian.
We're in the middle of a global pandemic and a civil rights movement at the same time, it seems like. And there's just, I think it's imperative for us to acknowledge the health inequities that do exist. And those same people of color are experiencing a lot of those inequities. And so I think now is more than ever such an important time to assess for those barriers to treatment and barriers to care that families might be facing, and providing those resources, especially with the unemployment rates. I think that's my biggest fear when seeing, the numbers of unemployment rates is, man, so many of our patient families, kids don't have jobs. They rely on their parents' jobs for insurance and for coverage. And so many people are impacted by this. And so just assessing for those barriers and providing those necessary resources, but also, ensuring that our patients and our clients and our peers even feel valued and respected in those facilities when they're coming in. We have to continue to hold space for these very necessary conversations and providing space for support for families. I, a lot of times, will meet with patient families and they feel intimidated by the medical team. And so I'm always encouraging parents that they are an essential part of their kids' care team, and to just ask questions of the doctors and make sure that they're fully understanding, the extent of their children's medical needs, and making sure that they're following up for their well-being. And so just being a part of those necessary conversations and making sure that patient families are feeling respected in their spaces as well too.
Thank you, Adrian. And we'll move to Carmen next.
Yeah, I would have to say when, and just listening to Adrian and Chris, kudos to you ladies both in the health field. I can only imagine what this may be like right now for you guys. I will say that domestic violence is a public safety issue, but it's also a public health issue. For many weeks, the survivors that we were hearing from, because, of course, they were fearful of, the actual pandemic itself, of actually getting, COVID-19 versus, what's happening in my home. Initially, so many of the calls that we received in the beginning were from those that were in the hospital because they were hurt so badly, they were hospitalized. And so it really, it was just, you were seeing the severity of the cases were just so bad in the beginning. And I think they still are. I think it's just, those were the situations in which we were hearing from survivors most. I think that, of course, in listening to what you ladies have shared in your hospital settings, I'm thinking about that there is such an inequity when it comes to healthcare and healthcare access in this country. And so we are starting to see that more and more. It's just becoming more evident. And if the recent statistics of, COVID-19 infection rates and severity, if that has not shown us anything, I mean, to me, that's what it has shown me. And so it is definitely time to do something about that. I get, because I'm a mom as well. And let me just say, I, like Donetta, have been trying to manage that. Mommy and daddy school, definitely not for me. But that is my priority. And so I have to make sure that, I am, the work that I do already puts me at risk, but I want to make sure that I'm doing what I can to stay healthy for my family as well, and to support them. So I may not get to do some of the things that other people maybe can do. So I would love to be one that's out and protesting, but really that's not feasible for me to do right now. So I have to think of ways in which I can work to make changes within just kind of my system. And so for me, I would say that you just need to start somewhere with addressing these issues, because we know that they're there, there are issues. And so, I told my team that I was starting by having a conversation with our CEO, and that's what I did. And, just let her know, there are some things that I know we're going to have to do differently here. And so this is just the time that I think that we need to start. So start somewhere. That would be my, my advice to anybody who's wanting to speak out against these inequities that we're seeing right now.
Thank you, Carmen. Appreciate that. And we'll move to Michelle.
I will basically just piggyback off of what everyone previously said before me. I would say my biggest thing is acknowledgement of the racial inequities and discrepancies and discrimination. Acknowledge, and then educate yourself, educate others, and advocate for what we as social workers is a part of our profession, is a part of who we are, is advocacy, and understanding the importance of that in the medical field, as well as mental health first aid. I can't stress enough how important that is, to be able to recognize those red flags. Suicidal ideations have been such a huge increase since this pandemic has started amongst all populations, but definitely amongst youth. So acknowledging that and understanding that and checking in and just asking questions, not to just say, how are you doing, but to really care how they're doing. So listen and receive that information, and talk about how all of the different things that we have going on in our cultural climate right now affect each of us differently, and how we might not always express it's affecting us. Sometimes we keep those things bottled in, but it does affect us. So acknowledging that and talking to people about that. And I think that's just one of the most important things to do, is just always acknowledge it.
Thank you so much, Michelle. We'll move to Donetta.
I'm going to definitely agree with each one of these ladies in that acknowledgement, education, all of those things are so important. And just in looking at, from the field office perspective, us having the ability to still send people out into the community that are still addressing these concerns, and working with students who may have concerns of their own in dealing with this. I'll also say that I've been really appreciated the response that UTA has taken here recently, from the protests that we had with the School of Social Work, to creating kind of a circle for students of color. Those things have really seemed to be helpful and beneficial. Again, in just giving a safe space for people to talk about and to really acknowledge what's happening. So I just echo what everyone else has said in that is so important. And I think for me and for us as social workers, as we're educating students to go out and help others, to make sure that they think of these things and that they acknowledge that there is a discrepancy, that there are these, that it's not equitable, and really understanding what that looks like when you're practicing in the field. So that, I think, to me is what's most important, is that we are educating those that are going into the field and actually doing this work.
Thank you all so much. We are going to move to our last question about self-care. And the question is, what does sustainable self-care look like right now? And we'll start with Chris first.
Self-care is always something that I myself have struggled with, but I did at some point learn to deal with it, and I'm having to relearn how to self-care because like I said, the number of COVID people affected by COVID has astronomically increased. So, but I can't effectively help these patients or our staff members without helping myself first. So, because if I burn out, so it won't help anybody. So, just remembering to leave work at work is the biggest thing I have to remember. Hopefully, these patients will be here tomorrow, or the plan is for them to discharge, or however that happens. But leave work at work, and then just take time for yourself. Whether that's reading a book that's on your book list that you haven't even looked at in months. Give yourself that time and that break. And if you need more than just 30 minutes to yourself, take it. And I am guilty, always guilty of not taking a lunch break. So that's one thing I always have to remember is, hey, step away from that desk for just, whether it's to take a walk or eat lunch, or just give yourself that time. Because if you're constantly going, you're going to run out of those batteries. And you need those batteries. So.
Thank you so much, Chris. We'll move to Adrian next.
I completely agree with Chris. Leaving work at work is probably one of the most important things that we can do for ourselves when we are out on the front lines and we're in the healthcare setting. And so we're seeing everything firsthand. Of course, I love, pre-COVID, getting nails done, doing all the things, going to the spa, all of that. But self-care doesn't always have to involve spending money. So I've been scaling back on a lot of that, not by choice, but it just kind of is what it is. But I think the most important thing to remember is self-care is about taking time for you and doing something that you enjoy, and it's unique to everyone. I've just been really mindful of my energy because there's just some days where I'm just drained. I just do not have the energy. So being mindful of my energy, knowing when to take a break from social media, because the news is everywhere. You see COVID at work, you see it on TV, you're talking to your friends about it, knowing when to disconnect. I love to sleep. I take naps religiously. I have blackout curtains, so it's nighttime anytime I go in my room. But just taking that time for you. And my favorite form of self-care since everything has started is just saying no. I have been saying a lot of my friends and family are not taking this seriously. And so I have been comfortable in saying no, like I'm not coming to your birthday dinner, your birthday party. I'm staying home, I'm staying safe. And so just being comfortable with that, and we do so much for others. So making sure to make yourself a priority and take care of yourself.
Thank you. We'll move to Carmen.
Yeah, Adrian, let me just say I'm a Louisiana girl, so that is such a huge part of our culture, and just fellowshipping and gathering, like, for everything. And yeah, I have definitely been more comfortable saying no. And so I think that is so very important. So thank you for saying that. But definitely sustainable self-care. And I believe self-care is probably going to be one of those words when this pandemic is over, we're all going to hate it. But it is so important, especially in the work that we do. And so whatever that looks like for you, you may just have to, think outside of the box again. And as far as what you maybe used to make you feel good, what can you do? But if you're used, because I'm definitely, as soon as it's warm outside, I'm the girl that's in the nail shop getting a pedicure. But maybe that's just me giving myself a pedicure, and learning how to do that. Finding something new to learn. I have a friend that was like, I've always wanted to learn sign language, so she's taking a class right now. For me, one thing that is important, I know, I mean, we're social workers, we do things because, we love people, and we have compassion and we care. And so I think it's very easy when you are working to just kind of get focused in the work that you do and focusing on the population that you serve. But how can you do something for somebody else? That makes me feel good. If that means that I'm paying my hairstylist, who has now had to, shut down her salon, I'm just, paying her as if I was still there, because right now I'm still working. My husband is still working, and fortunately, that's, it's good for us that we're able to do that. But for so many people, they have been impacted by this. And so, what can I do to help somebody else? That makes me feel good. And then also being grateful for what I have. I am very grateful that, there are always social work needs, because that's what's keeping me in my job right now. And so I have to be grateful for that, and that I'm able to possibly save a life. I'm still able to do that in the work that I do. So keeping a gratitude journal, I think that's so important to do, because you can so easily get bogged down with the things that, you're not able to do right now. That it's very important that you're looking at the things that you do have and that you can do. And I also agree with the news. It's really important as social workers, because we have to, of course, stay relevant. So we have to know what's going on, but there's also a time to turn it off. And maybe that just looks like you get your news in the beginning of the day, you get your news at the end of the day. Turn off notifications, news notifications on your phone. Watch how much time you're spending on social media. Your phone, most phones now, I believe, will show you how much time that you've dedicated to certain apps on your phone. So just be mindful of those types of things. And again, just taking care of yourself. Don't forget that. Don't forget to do the things that you need to do to stay healthy, because this will probably be going on for a while. And so you still need to make sure that you are doing what you can to stay healthy physically and mentally. And so for those of us that are working and having to work remotely, that was the very first thing that I explained to, my staff was, we're not used to doing this. And I do not want, when you have to bring work into your home, it becomes very challenging to separate that. So make sure that you have set hours to do work. And I'm bad at practicing that, but you really, really need to.
Thank you so much, Carmen. And someone had posted on our word cloud about cutting social media and being flexible as well. We'll move to Michelle next.
I feel like everybody's kind of already said all the things that I definitely would have said. I think unplugging is a huge part for me. Just I have to take that time away from social media because it comes at you on all fronts: my phone, my computer, my TV, and just my coworkers. I mean, we discuss these conversations and we talk about this all the time. So sometimes I just have to unplug, and that's self-care for me. I would also say self-assessment, checking in with myself and recognizing when I'm getting to that level of possibly compassion fatigue, and knowing, hey, I need to take a step back and I need to do some things for myself. Maybe if it's take a day off and just kind of reset my brain, whatever it is. But I definitely think that making sure that I self-assess and self-reflect regularly is super important. Also, just taking the time maybe to actually do some of the things that I post on my Pinterest page that I never actually take part in, but I like these things and I think one day I'll do them. Maybe doing one of those things could be some self-care. I haven't got to that level yet, but maybe, hopefully in the near future, that could be one of the things that I could do to sustain and have some self-care for myself.
Thank you so much, Michelle. We'll move to Donetta.
Yes, of course, I agree completely with my counterparts in that, being flexible, taking care of you and putting you first in certain instances, and definitely stopping and having a good work-life balance, which is something that I've definitely had to really, really work on, especially working from home. And, everything is happening now in my home, from school with kids to kids being here all day, all of those things. And so really making myself have a firm cutoff time, which is typically still too late, but still having that time. But one of the things that I've also recognized in all of this is just being appreciative of being able to watch my children grow. I think that it's something that I didn't think about, because, we go to work all day, we do what we need to do, we come home and it's like, okay, shuffle dinner and things like that, and just, off to bed or however. And so for me, it's being able to see, these small things happen, from my daughter being potty trained now to, my son finishing 4th grade, and actually being able to be present in there for those things. But then also for myself, for me, it takes a lot for me to get there and say, okay, I've hit capacity. And I will say that I've hit capacity. I recognize that. And so being able, for me to be able to recognize that and actually say, you've hit capacity, you need to stop. You need to take or you need to take a vacation. You need to take that time to really get away from. I think that working from home, you don't think, well, I don't need vacation, or I don't need to take sick time to a certain degree, because you're home. So it's like, I can still keep going, but you still need to stop and really take some time to kind of debrief and recoup and relax. And so that has definitely been for me, just acknowledging that I need to take that time for me, and also being appreciative of the time to be home with my family has been probably the most sustainable thing in self-care.
Thank you. Thank you all so much. Those are some great ideas to help our anybody watching, our attendees, about self-care. It's really important piece that we sometimes take for granted as social workers that we don't do. And like Chris also mentioned, is we as social workers are not just there for our patients or clients, we're often called upon to help take care of the staff as well. So just kind of making sure we can't take care of other people if we're not taking care of ourselves. So it's important. We are going to move on to our questions. And right now we have our first question. Aaron asked, what will you do if significant numbers of your staff are infected? Anybody can answer that if anybody's discussed kind of what the plan will be for your staff.
Oh, this is so funny because we literally are having that situation right now. So we're actually working on it. we did have the very first staff member for the agency tested positive out of our department. So from there, we ended up having to go into a quarantine, and we just got back this week. And so it did, we had to come up with a plan literally overnight. And so we did, and we made it work for 2 weeks because it was going to be the first time that we were not going to be able to be here for anybody that walks in for emergency purposes. And we did not have access to our crisis hotline. And so we had to, of course, move the crisis hotline into our emergency shelters. And so we had staff that were going to be coming in to answer from there. And we came up with the like, hey, this is what you need to do for these calls. And we made it work. We're currently now, because since that time, we had a staff member test positive that has worked at both of our shelters. And so it's at this point, what we're just figuring out is going to be how can you keep people, away from the building, quarantine, whatever they need to do. Of course, trace the exposure, which we've done. Fortunately for me, I only had to contact one client. So I was grateful for that. But making sure that we are doing the appropriate tracing. And then in an event that a number of people have to quarantine out, then we've had enough people that have been working remotely that can come in and provide services and be there to help until those employees are able to come back into the office. But our CEO has been very, very clear that we're to wear masks at all times, unless we're in our offices with the doors closed. But we are doing our very best to try to maintain. And of course, we've been wearing masks forever, but it does. You kind of get, you slide it down, it gets uncomfortable. You're not necessarily doing the best practices. So she's been very, very adamant about that and very clear that we are going to do the things that we can to make sure that we minimize our exposure here.
Thank you, Carmen. Does anybody else want to kind of share what your agency or employer has set up if individuals are impacted by COVID? We have a couple more questions. We'll go to the next one. Have there been any agencies, resources, or services provided for COVID relief that have benefited your clients? That question's from Robin.
I do know that for us, a lot of the group homes weren't taking back the patients that had to enter the hospital for COVID treatment. So our care connections team and our homeless outreach was able to assist them because they were technically at risk of becoming homeless. So they were able to access those services at the shelters. So that was pretty good.
Thank you, Chris.
Yeah, and I will say we do, we have a housing team at Safe Haven as well. Like I said, that's where I started. And what they have done is they have worked, they've been able to, secure funding to be able to house. They've been able to house our survivors. So they've been able to house a number of clients that are in the shelter because we do work on a coordinated entry, just like any other homeless provider in the county. And so it's a coordinated entry process. So generally our clients come from Tarrant County Homeless Coalition that have identified as experiencing in their assessment that they've experienced domestic violence. And a lot of times they do end up being clients that we've served at Safe Haven, but there are a number that are not. And so our housing team, whereas a lot of housing programs have been unable to still house homeless population, we have been, and so we've been able to do that to help kind of get families out of the emergency shelters, leaving our already limited capacity for those that have emergency situations and need to come in. So they're working really, really hard to do that.
Thank you.
I think for me, in us creating kind of the in-house program to support UTA students. So for me, my client obviously is the intern. And so one of the things that I hope is that it will be beneficial on both parts. So not only will it help with isolation with our UTA students, but it'll help with isolation with our interns. And also looking at, our interns being able to see what resources are available if they need those resources, that they also know to take advantage of those resources that they need. And so I really hope that this initiative will really be a twofold in being able to help the interns in their own growth, if you will, as a professional, but also in their personal lives, that they may, they still are students as well. And so that is one of the things that I wish I could say that it's definitely going to happen. I'm very sure it will be a benefit, but because we've just literally started, we don't know the effects yet, but that is the hope, is that it will be effective for the students that the interns are serving, and also for the interns.
Thank you, Donetta. We have another question. It's what COVID-19 practices, if any, will you and or your agency keep once we have moved past this pandemic practice?
I'll say definitely our social media presence. It is something that we've always had. We just haven't been very focused on it because we provided direct practice services. So it was something that was kind of in the background. It has definitely become more of a forefront for us. So we'll definitely continue to provide educational information. We have something that we call Factual Fridays that we put out every Friday. So it's just some education information, a quick little video that you can interact and engage with us or ask additional questions and we can follow up about, and just other things that we can do to engage the population that we work with in the community. So we'll definitely continue to promote and be present on social media.
Thank you, Michelle.
I'm hoping that we're going to be able to keep believe it or not, some of the remote services that we've been doing. And so our, clinical team has a telehealth platform that they're using. And, right now, whereas this being the only form, the only way in which we can provide services right now, it's challenging a lot of times. But, as I've stated before, the barriers that our clients were dealing with prior to this pandemic are still there. And so it is still very hard to access childcare. It is still very hard to access transportation for those that are not living in, the area in which you have mass transit. So a lot of those things are still a barrier. And sometimes being able to offer services remotely is helpful for those clients that may not be able to commit to coming to the office, once a week to meet with their, clinician or case manager. So I actually would still like to be able to have that as an option for clients.
Thank you, Carmen. Justin asked, have any of you implemented or been a part of compiling any manuals for students, faculty administration, and or parents for re-entry into the public school system post-COVID-19? If so, where did you start or what was beneficial?
I feel like I'm gonna be the only one. I mean, Safe Haven is so huge because we have like a number of wraparound services. But of course, emergency shelter, we do have obviously kiddos, so we have the schools, and so we literally were just talking about that today and trying to figure out what would be the best options for our Fort Worth shelter. We actually have Fort Worth ISD staff that is like on site, so they are there all school year to teach our kiddos in shelter and that's all ages, so all grade levels. Or, you always have the choice to be able to, if it's safe for your kiddos to remain in their current school. For our Arlington shelter, they are not on site, but we actually work with the local schools in the area. And then we have transportation to those local schools in the area. So one of the discussion points actually that was mentioned today by our COO was, could we possibly consider having somebody come on site for Arlington ISD, in a similar model that we have for Fort Worth. So those are just things that we're thinking about. But as far as like a manual, because I feel like all ISDs right now are, me personally, I get like a different message every day from my kiddos ISD. So they don't even know what they're doing. So I think it's going to be really, really challenging on re-entry in the school process. So I think the good thing about Safe Haven is at this point, we're flexible, we're open, and we're going to do what we have to do. And so if that means that kids are going to school virtually, we're going to figure out how to do that the best that we can. So.
Thank you, Carmen. And the next question is actually specifically for Carmen. How has youth in the emergency shelters been impacted? And are there any additional supports for children during this time?
Yeah, it's definitely been impacted because summertime is one of the things that we do really, really well. So we have a summer camp that we do every year. And so the kids have, activities from morning till evening. And then we have so many wonderful donors in the community that donate time and they donate their services. So, we would get NRH2O passes, like season passes for our kiddos, and they would go like once a week. We did all these types of things. And so we can't really do that. So we are very fortunate in that we do have a children's program. We have a children's program director. And so she is still providing some of those activities for the kiddos. She is working within the system that she has. And so, it's really kind of hard to socially distance kiddos. And so if anybody has any, that's about impossible. But we have area in which they go out and they have activities and do what they can, but it's definitely challenging, and it's not the way in which we would, love to see our kiddos be able to enjoy their summer. Because that is something that we do very, very well, but we've had to cancel our camps, our sleepaway camps, and all of those things.
Thank you. And I know Adrian at Children's, they do some camps as well. So I was hoping that she could kind of say a little bit of what they did to kind of be flexible to make that happen.
Yeah, a lot of our camps, like our heart center camps and like our oncology patients, they typically will have a camp every summer for the kiddos. We also have like ECMO reunions for patients that are on that. And we also will typically have like a grief camp called Camp Soul, which was also canceled this year, but they did virtual ways of doing that and reaching out to those families in that way so that they, were still able to participate in some capacity. But there's been a lot of impact from COVID-19 with that this year, but they were able to do it in a smaller capacity.
That's great. That they were able to still get that connection. Another question we have for Adrian and Chris, have you received any additional training for COVID precautions in the hospital?
The main thing, so we kind of rolled out at the beginning of March. They put like a tape in all of the rooms, even down in the ED. And so there is an area that we can step into rooms, non-COVID patients, but we can step into rooms to prevent putting on PPE. So we still wear our community mask and goggles everywhere in every room that we're going into. But in order to preserve that, that's something that's been implemented. And then just encouraging us to utilize the phone as much as possible when appropriate. So we're doing that. And then really it's just, from a social work standpoint, we're trying not to go into any of those rooms. And so that's really been more so on the medical side, but just limiting, even like for rounds and medical updates and things like that, limiting the amount of people that are going into those rooms. So, you know, a lot of times doctors are in large teams. So instead of the whole group going in, having one representative go in. And we've been doing a lot of our meetings and things like that virtual. So if it's usually less than 5 or 10 at the max, depending on what it is, but we're really just doing everything virtual as much as possible, and just trying to limit this exposure and encouraging social distancing.
Thank you, Adrian.
Adrian said. Also, what we have been doing for any type of meetings that we do have, everything's been moved to teleconference as much as possible.
Thank you. For Michelle, how has substance use been impacted by COVID?
Well, there's definitely been an uptick in substance use and substance use disorders, as well as domestic violence and CPS reporting, CPS incidents. So as we can imagine, you know, with the pandemic, there's been a lot of stress and anxiety, job loss, uncertainty, health, death, grief. There's just so many things that are compiled upon each other in the midst of civil disruptance. There's just so many things that are kind of, it's almost a perfect storm at this time for someone who is dealing with substance use disorder or someone who is in recovery. Definitely a lot of relapse happening during this time as well. And that's for all demographics, from youth to the geriatric community. So it's definitely been a huge impact.
Thank you, Michelle. We have another question for Carmen. What is your agency doing to keep the children active, and are the children allowed to interact with each other?
So I don't know how much interaction they're able to have with each other. I think the activities that our children's director is coming up with are things that they can do, you know, and still be able to social distance. But because I will say, because we are reduced to like, God, I don't even think it's half the capacity. You know, we have family rooms, and so it's, you know, one family per room. We also have isolation rooms. We have, you know, we have a number of things kind of going on. And so the point is to try to keep everybody, you know, each unit individual. And so you kind of end up with your kiddos, you know, remaining with their parents. But, you know, it's really, like I said, it's really unfortunate that, you know, our kiddos have not had the opportunity, because we know the trauma that they experience, they need that, just kind of that outlet. But, you know, like I said, we've had great donors. And so we've had great donors that have been able to kind of offer services and things for our kiddos that they can do virtually, and doesn't require them to transport them anywhere or anything like that. So yeah, they have masks. We have masks for kiddos as well. And again, anybody that has kiddos or have worked with them, you can only imagine how that goes. But you know, they're doing the best that they can to work with them, because it's still a situation, but they still offer a traumatic situation, excuse me, but they still, we offer our children's therapy. Our play therapists are doing play therapy virtually, and you can only imagine what that's like, but whatever we can do to try to help, we are doing it.
Thank you, Carmen. For Dawnetta, has there been any positive outcomes of the case management services of the new program?
I unfortunately can't report to say as far as us reaching out, doing the outreach portion, that there has been, because we just started that this week. However, I will say, as far as administratively, we've had some great things that have happened. We have sections of students that are working on support groups. We actually had a couple of sections of, or actually a few sections of students that divided the entire state of Texas into 4 quadrants, and now we have resources in each one of those areas. So administratively, we've had some great strides in being able to get things up and going, because literally we had a couple months to try and put it all together. So students have just started reaching out to, or excuse me, interns have just started reaching out to students and providing case management. So no outcomes as of yet, but I'm looking forward to that in the next couple of weeks.
Thank you, Donna. And I saved what I think is the best way to end this Q&A session. What advice do you have for recent UTA graduates or ones that are graduating soon who will be entering the career field of social work while the pandemic continues in the fall?
I'm hiring. So if anybody is looking, I'm hiring. Please feel free to go to our website and look at the available positions. But I think it's still important that you put yourself out there. And I promise there is absolutely job availability right now. You're going to have to keep in mind that you're going to have to be flexible because the role that you apply for may not be what you're doing. And I think that's just in general, but especially during this time. I mean, because I literally just had a conversation about this with my COO that, we're just kind of in an all hands on deck right now. And so we are prioritizing the services that we need to for survivors. And so, I think that's going to be anywhere. It's just, yeah, you may be hired to do case management, but you may end up being the cook one day. You just you just never know. And so you have to keep that in mind. And just, like I said, just be flexible and be brave because a lot of the work that we do is essential. And so you're going to be out there on the front line. So just be prepared for that.
Thank you, Carmen.
I want to just echo what Carmen said. Definitely be flexible. We talk about this so much in field, because often students are like, I want to do this specific little box. And it's like, but that little box right now is like this ginormous box. And so you have to be flexible in what you're doing. But also one of the things that we do is in the last semester of field, we have students update their resume. Which has been actually really great because students get the opportunity while they're still fresh in their placement or freshly starting to come out of them, to make sure that they've captured everything they've done in that placement. Field experience, because it's a requirement, because you need to actually be able to apply the things that you've learned, but then you also need to be able to showcase that to employers because they want to see that you've actually spent some time in front of a client or done some work in the community or however. So they want to be able to see that. So making sure that you're able to capture all of that work that you've done. And especially now in the pandemic, being able to talk about, you've already done some telehealth work, or, you've already done some support groups virtually. Those sorts of things are so important to be able to highlight, because I think in the future, and as we continue, we'll continue to see a lot of these things a lot of these virtual placements, if you will, or virtual task continue even past COVID, because I think that there's been some great success in it. And so being able to highlight those things and, just like Carmen said, be brave and go for the positions that you want. But make sure, again, that you're really highlighting your skill set and what you've learned, whether it's in field or beyond in your resume.
Thank you, Dawnetta.
I'll say one of the things I usually tell interns at our agency, we usually have about 40 to 50 interns a semester. So we have a large group of interns that we work with. I always encourage them to use their social network. They are in a unique position to build a wonderful social network with future social workers who are going out into all avenues of the field. Keep in contact, because when jobs open, those are the first people who usually know about them. So if there's an agency that they're working with who's hiring, or they know someone who needs a position, having a really great social network is so important in this field. So utilizing that network that you're building and staying in contact with one another.
Thank you. Yes, I talk a lot about networking and how important it is to stay in touch with your peers that you're in school with, and then as well as your field placements. So I will just say thank you to all of our panelists, and appreciate all the questions from everybody that is attending, and hand this over to Rachel.
And the first thing I want to say is absolutely echo that. Thank you so much to our panelists who shared your expertise, your time with us today. We're so thankful both for your time today and for the work that you're doing across our community. You are exemplars of social work's commitment to social justice, to social change, to enhancing well-being of individuals, groups, communities, and society. And we were honored to learn from you today. Thank you also to the people who helped organize today's event. That particularly includes our amazing communications team at the UTA School of Social Work, and a special thank you to Coral Simpkins-Mims, who worked to organize and plan this event, as well as the full panel series planning team of UTA School of Social Work faculty and staff, who helped conceptualize and organize this series of 3 events. On that note, please save the date for the final event in our series, which is a town hall, again hosted on Zoom and Facebook, titled "Where Do We Go From Here? COVID-19 and Diversity." It will be moderated by Dr. Jandel Crutchfield on July 16th at 2 p.m. Thank you all for joining us this afternoon, and have a great rest of your day.
Thank you.